everyone. This is Nurse Gusta RN, and welcome to Community Communications. Today, our discussion will be about hypertension, better known as high blood pressure. So, first of all, I'm going to start out explaining what blood pressure is. Blood pressure is the pressure of the blood against the walls of the arteries. When your blood pressure is high, it can damage your arteries and heart by increasing the workload of the heart and blood vessels, making them work harder. Over time, the friction and force of high blood pressure damages the delicate tissue inside of your arteries, and tiny tears form in the walls of the artery. LDL cholesterol, which is the bad form of cholesterol, can form plaques along those tears, beginning the start of atherosclerosis. Now, this disease is when plaque builds up inside of your arteries, and is also known as hardening of the arteries. If your blood pressure is left uncontrolled, it can damage not only the blood vessels in various parts of your body, it also is likely that untreated hypertension can damage organs such as your heart, brain, kidneys, or eyes. This leads to heart attacks, strokes, heart failure, kidney disease, erectile dysfunction, and loss of vision. Now, in the African American community in the United States, there is a higher incidence of high blood pressure than other racial and ethnic groups. High blood pressure is also often more severe in African Americans, and some medications are less effective in treating hypertension in African Americans. Blood pressure usually has no symptoms, and it is known as the silent killer. And that's why, because it has no symptoms. The only way you will know that your blood pressure is high is to have it checked on a regular basis by a healthcare provider. You must know your numbers. This will aid in the prevention and management of high blood pressure. Normal blood pressure is below 120/80. Now, in your blood pressure reading, you have two numbers. The top number is known as your systolic blood pressure. The bottom number is known as your diastolic blood pressure. And to determine if you are hypertensive, the guidelines are a systolic, or the top number, of higher than 130, or the diastolic, or the bottom number, higher than 80. So, with a number, the top number being higher than 130, the bottom number being higher than 80, we will be considered as having high blood pressure. Checking your blood pressure is quick and easy, and it's painless. You can have it checked at your doctor's office, in a clinic, pharmacy, or health fair. You can also purchase a home blood pressure monitoring kit so that you can check your blood pressure at home, and your doctor can give you the frequency in which you need to check your blood pressure. Now, what can you do about your blood pressure? You need to make sure that you check your blood pressure and know what your numbers are. That's the key. That will help you to determine if you are hypertensive or not. Make sure you're checking your blood pressure and you know what your numbers are. Now, if you have been diagnosed with high blood pressure, and you've been prescribed, well, I'm having trouble. If you have been diagnosed with high blood pressure and you have been prescribed blood pressure medication, take your medication as directed. Please take your medication as directed. And the best way to control your blood pressure is to have lifestyle changes. Though you may have been diagnosed with high blood pressure and they've given you medication, you still need to take your medication, but you can do these lifestyle changes, and if it helps to decrease your blood pressure, there may be a chance the doctor can get you off of blood pressure medications. And I will be coming with a part two to give you some other alternatives of helping things to help control your blood pressure. But in this time, these are the things that I'm suggesting for you. To do not smoke and avoid secondhand smoke. And this is something that's not known very widespread, but if you smoke and you have high blood pressure, and because of your LDL cholesterol, which we all have, that forms as plaque in your arteries, the smoking will accelerate the growth of that plaque in your arteries, which can lead to increased chances of a heart attack, increased chances of a stroke, because the arteries, there are arteries around your heart that can get plaque in them. The arteries in your neck get plaque there, and then the arteries in your legs, in your lower extremities, can get plaque. And you can have pain, and circulation can be cut off to your lower extremities, like your feet, because of those blockages. So it's very important that you don't smoke if you have high blood pressure. You need to reach and maintain a healthy weight. Eat a healthy diet that is low in saturated and trans fats, and that is rich in fruits, vegetables, whole grains, and a low-fat dietary product. Saturated fats are found like in red meat, butter, whole milk, and the trans fats are palm oil, vegetable oil, hydrogenated oils. Should avoid those. Unsaturated fats are the good fats that are found like in canola oil and in safflower oil, sunflower, olive oil, avocado oil. Those are all good healthy oils for you to use. You should also aim to consume less than 1,500 milligrams of sodium per day. That is the salt. Eat foods rich in potassium. If you have been diagnosed with kidney disease or you have kidney issues, you need to consult your doctor about this potassium intake, because potassium is restriction is recommended with those who are having problems with kidneys or kidney disease. So check with your doctor on that. Limit your alcohol intake. Be more active physically. Aim for at least 90 to 150 minutes of aerobic and or resistance exercises per week. Also, walking is the great, wonderful thing for you to do. You get outside, you get some good mental health effects from that, and you're using every muscle in your body as you walk. So it's a good exercise for you to do. Drink plenty of water as well. Keep yourself hydrated. And you make sure that you get your blood pressure checked and know your numbers. Very, very important. Don't go along guessing, and you don't have to wonder. It's a very simple, painless thing to do to get your blood pressure checked and know, and take care of yourself and your body so that you can live a life that is productive. All of this information that I have given you has been obtained from the American Heart Association. You can go to their website and look up this information and educate yourself on the things that you're interested in knowing about your heart and anything concerning your heart and circulatory system. Now, like and share if you're watching on Facebook. I would appreciate it. Like and subscribe, as well as share if you're watching on YouTube. I really would appreciate you subscribing to my channel. You may also leave suggestions for future topics of discussion at nursegustarn@gmail.com. That's nursegustarn@gmail.com. I hope this information has been of some help to you, and I would appreciate you again subscribing to my channel. Thank you, and God bless.